Alright, so this is going to be the correct way on putting specific information into Fisdap for the tracker. This should clarify everything and make it to where everyone's able to properly get all the requirements done. These are the 3 tables that need to be done before August of the start of the next semester. There's ages for table 1, table 2 is pathology complaints. Where you see the asterisks, those are simulation permitted. I'll go into further detail on how to properly put those in under simulation skills. Even though it says they're required to be done in the field, they're allowed to do it in the lab. The easiest way to do this, I figured out, is if you have a bunch of shifts that need to be unlocked, whether it's a lab, field, clinical, whatever, just start at the very bottom of Fisdap. Look at the stuff that you put in under skills that we did in the the first semester back all the way in September, and write it down, because a lot of those skills that we did go towards simulation permitted. So in order to get that stuff off, you have to have them unlocked, and you have to put them in under a patient, which I'll show you how to do in just a second. Alright, so this is going to be just inputting your lab skills into table 3, column 1, which is the lab setting. This doesn't cover the simulation permitted, but for the sake of this tutorial, I'm going to be using 10/22/24, which was a lab day. So to start it off, I have a creg that I need to put in under a patient that I did that day from my notes that I took. So I'll go on to Fisdap, scroll down to October 22nd, you'll click on it, and then with that, you're not going to make it a patient. This is just going to be an individual item. So this will count towards table 3, column 1, which is the lab setting. So this will be an individual item. So you can see there's cricothyrotomy / surgical airway. If you look at the SMC CoAMP Tracker worksheet that we were given, some things have a certain way that need to be put in. This one's pretty simple. You just click on it. You're going to go under date, change it to the day that lab was, make sure that it has your name under it, and then with that, you would just simply press save, and then that's it. Alright, so this is going to be inputting the simulation permitted skills into table 3. There are a decent amount in the skills that are simulation permitted, because most of them you probably won't encounter on a clinical or ride time. I think this is where a lot of the confusion was happening. So to start it off, in order to know if it's simulation permitted, you need to look at if there's an asterisk next to it. If there is, then it's simulation permitted. So for the sake of this tutorial, I'm going to be using that same date, 10/22/24, which was a lab shift. I'm going to be doing the crike again to put it in, because that's a simulated, that's allowed to be simulated. So with this, if you just put it under skills, it won't count towards the patient encounter. You have to physically go in and press the plus button and select patient. Make sure it's under practice, which is formative. Competency exam, summative assessment is going to be the capstone in the fall. But the important thing is to make sure you press mannequin, and with it being a mannequin, the system already knows that it's allowed to be simulated permitted. So the only extra info you need to add is an age. That is easy. You can just kind of fake it, put whatever it is, or if you have the notes, put that in. But with this, then you'd go under interventions / individual items. You can see me click on it there. And that's where you would press the cricothyrotomy / surgical airway. According to the CoAMP SMC tracker sheet, that is what's required to make it count towards it. Some of them you have to do other things, but again, just change the date. Time isn't important, and then you can just put in there if you want to. You don't have to. I just put lab simulation or lab simulated skill, and then save. And then once that's saved, you can go ahead and go in. If you have more stuff for that day you need to add, you can go ahead and add it. But all in all, just go in, make sure everything looks good. It has to be mannequin. It won't let you save it without an age. And then you would just save the patient. And then I think I go back and I just verify that it's there. But what you'll see is when you go on it is you'll see skills, your skills that you've done, which again are counted towards table 3, column 1, which is the lab setting. And then with it being under a patient, it'll count it towards column 2, which is a clinical / field setting. All right, so this is going to be for the lab pediatric patient skills input shift. First things first, if you have anything in the yellow for pediatrics, it's wrong. You need to have the green shift unlocked and transfer that information over. Secondly, this is news to me today, but because it's like a green shift, it's considered like a clinical, so there is no mannequin. Regardless, even though it is a mannequin, it's treated as a live patient. So you're not going to choose mannequin, you're going to choose live patient. So the benefit with this is you can do a lot more stuff. So I was having trouble getting IM injections. So we did an anaphylaxis one with Mike one day. So I counted that as my IM injection of epi. So that knocked one of them off because the administration of IM injection is not simulation permitted. But because this is not considered a simulation shift, it's considered a clinical, I was able to do it. Starting with this, you can see I go on the shift. I chose June 24th, 2025, which is today as an example, just because I need to go back and look at what day the anaphylaxis thing was. But with this, the big thing is it's patient, right? And you aren't going to choose mannequin. This is treated as a live patient. So keep it under human. Status is alive or dead, whatever it is. And then just enter an age. According to the CoAMP sheet, anything under 19 is considered pediatric. So all your interventions, individual items, you'd go in, put it in. This one, I chose med administration. It's under today's date, so I don't have to change that. Go in, look for whatever drug you gave, whatever it was. In this case, it would be Epi 1000. Route, I said I needed an IM, so I put it as IM. You can go in, you can put the dose, the unit, the med check. It's not required, but that's pretty much it. Alrighty, so this is going to be regarding table 2, which is pathology / complaint, parentheses conditions. There are a few that are simulation permitted. They'll have the asterisks again. So what I'm seeing is OB delivery with normal newborn care, complicated OB delivery, distressed neonate, cardiac arrest, cardiac dysrhythmia, and that's about it. There are a lot of different pathologies you need to get with your patients, but the benefit is you can, like, a lot of these are multi-system, so you're able to use your judgment to say what it is. So as you can see, this is under a field shift because in this instance, this one is not simulation permitted, and I need one of these. So all you would do is you'd go under impressions. In this case, this was I think 47-year-old female. She was a altered mental status. So in the video, you can see I put neuro other. That's not what you should put. You should put altered mental status. So disregard me putting neuro other. It'd be neuro / altered mental status. And then in this case, if you're altered mental status, she was also like psychiatric / behavioral. She wasn't acting like as she should. Like she was acting kind of crazy. So in that case, I can go under psychiatric / behavioral, and with that impression, there's really only one. So you do that. And then again, just make sure you're changing the dates because that is important if they were to get audited. All right, so this next piece of advice I just figured out today. Cardiac arrest and cardiac dysrhythmias for table 2 technically should go together by looking at that sheet that I have on the screen. They don't. Cardiac arrest trumps dysrhythmias, so there's only 2 arrests. Knock those 2 out. And then for dysrhythmias, it says you can do chest compressions or cardiac arrest for impression. So those don't work. They will go under arrest. If you put the impression as cardiac arrest, it will not go under dysrhythmia. So my piece of advice is get those 2 arrests done. And I know from the time of doing cardiology from January all the way down to March, we've had at least 10, whether you had a pace, whether they were bradycardic, whether they were tachycardic, anything other than normal sinus rhythm counts as a dysrhythmia. So for those, it wouldn't be under impression. You'd put an item, EKG with attribute interpretation, all attribute values except normal sinus rhythm. So go in, put EKG, change the rhythm from normal sinus to whatever it was. You can adjust whether it was from a 4 lead or a 12 lead. That's not needed. All you have to do is just put the rhythm that isn't normal sinus. If it was an arrest, don't even attempt to do the dysrhythmia. Just put it as an arrest. But if it led to an arrest and you already have your 2 done, I would just put the dysrhythmia because there's 10 of those that you need and only 2 arrests. All right, so this last page is kind of just things to take away. I'm not going to go too into depth. Pretty much it has all your numeral requirements needed in order to finish the semester. Anything in red is going to be super important, so feel free to just pause it and take a screenshot. Big things I want to go over are Table 2, multi-system. I didn't do a lot of this stuff because I didn't want to get kicked out of school because they talk about, people faking stuff. Or not necessarily faking, but, like doing too much at one time. And the last thing I want is to get kicked out. So now that we have clarification from Cassie that you are able to add multiple different pathology / complaints, feel free to go ahead and do it. Next is going to be Table 3, which are the skills. Big thing I didn't really go over is make sure you have your SMC tracker sheet, because some of these skills that you want to put in have to be done a certain way, and if they aren't done that way, then you are kind of it's not going to count towards your requirement that you're trying to check off. So before you start putting stuff in, I would just have a copy of the sheet just so you can look over it and double check, make sure that everything gets taken care of. And then one more thing is, I personally would just go ahead and grab a piece of paper when you have time and just start from the very bottom of Fisdap from our lab shifts and go in and see the stuff we've done and just write the stuff down that can be checked off. So if we were BVMing somebody all the way back in September and you still haven't hit your BVM requirement for Table 3, Column 2, but you did for Column 1 because that's the lab setting, then you can have that shift unlock and put it in. So the more neat you are, and what's the word? The more the more you write, and the more stuff that you are able to put down, the easier it'll be, and you can just knock it out in a day. So if anyone needs any help, just feel free to text me.